Hi everyone, welcome to Dr. Deepa's Learning Lounge. I am Dr. Deepa and I'm pleased to announce a new playlist that will be added in my YouTube video sections. So this will include the reporting dilemmas that the residents usually face. So these include only the gray zones or diagnostic pitfalls which make it very difficult for the residents to diagnose and report during exams. So we will go through these overlapping cases and I will give you the exam tips for diagnosis of the particular lesion. So today we will do one of the most common and most important, which is fibroadenoma versus phyllodes. So this will be solved from Dr. Deepa's Learning Lounge. So without much ado, let's look at the whole slide image. So one of the most common diagnostic pitfall in breast pathology is differentiating between the fibroadenoma and phyllodes. Both of them are fibroepithelial lesions, meaning both contain the epithelial and stromal components. And the key to diagnosis is careful evaluation of the stromal component. So start with the low power always. So if you look at the lesion here, you're able to see that there are areas in which you are clearly able to see ducts and the stroma. So they are sort of, let's say, about 50-50 of both. So it is not a stromal dominance. So this is usually seen only in fibroadenoma. So this is a core biopsy of the fibroadenoma that you're able to see. So this is a pericanaliculaar pattern where you are able to see that the lumen of the ducts are well maintained. Although the terminology peri and intracanalicular are no longer required to be reported, but this is typical of a pericanalicular pattern of fibroadenoma that you're able to see in this particular slide. So ask yourself a very clear question. Is the lesion well circumscribed? When you get a whole slide biopsy, is the lesion well circumscribed? How cellular is the stroma is the second question that you have to ask. And the third, very important, is are there any leaf-like projections and stromal dominance? So that itself will help you differentiate between fibroadenoma and phyllodes. In fibroadenoma, the stroma is typically bland and relatively hypocellular, and the ducts show either a pericanalicular or an intracanalicular pattern, and the entire stromal component remains more or less uniform, like in this particular whole slide image that we are currently looking at. Okay, now I will also show you, this is an intracanalicular pattern in which you are able to see that the lumen of the ducts are not very clearly ascertained, but these are arranged in somewhat antler horn or slit-like pattern all over this slide. So this is an intracanalicular pattern. But this is a main difference between an intracanalicular and pericanalicular pattern, where in the intracanalicular, the glands are compressed into linear branching structures, while in pericanalicular, the glands are retaining the open lumen pattern. So these two patterns are very classical of fibroadenoma, and clearly there is no stromal dominance. The ducts and the stroma are equally visualized. It is not the stroma that's catching your eye. And very clearly there is stromal uniformity and the stroma looks bland. So you're clearly picking up only fibroadenoma. If you take a look at this whole slide image, now look at the clues that are suggesting us of a phyllodes. The hallmark feature of phyllodes is increased stromal cellularity. Now, what is catching your eye in this whole slide is stroma itself. You're hardly able to see duct-like structures in and around. And if you're able, I'm just pausing it right here. So if you're seeing here, you're able to see this nice leaf-like pattern here. So this leaf-like pattern of stromal dominance is classical of a phyllodes tumor. So the hallmark feature is increased stromal cellularity, particularly around the epithelial line clefts. And this produces a characteristic leaf-like architecture in phyllodes, which gives the phyllodes tumor its name. Phyllodes itself means leaf-like. So in higher magnification, there are 5 important points that you have to evaluate in a phyllodes tumor. Those 5 points are very, very important for the diagnosis of the type of phyllodes tumor. So these include, one is the stromal cellularity, second is the stromal atypia, the third is the amount of mitotic activity, fourth is the stromal overgrowth, and fifth is the tumor border. These 5 have to be evaluated once you're sure it is a phyllodes. Once you have diagnosed phyllodes tumor, the same parameters help you to classify whether it is benign, borderline, or malignant. In a benign phyllodes, there is mild stromal atypia in the sense there is very minimal increase in the stromal cellularity. There is no stromal overgrowth. Fewer than 5 mitoses are seen per 10 high power fields. Always count 10 high power fields. And if there are fewer than 5 mitotic figures, then it means you're dealing with a benign phyllodes tumor, and it is relatively a very well circumscribed lesion. In a borderline Phyllodes tumor, there is moderate stromal atypia, moderate stromal cellularity. There is absent or no focal stromal overgrowth. There are about 5 to 9 mitoses per 10 hyper fields, and it is well defined or focally permeative in some areas or some borders. That is the classical feature of a borderline Phyllodes. When it comes to a malignant Phyllodes tumor, there is marked stromal atypia, there is marked and diffuse stromal hypercellularity, and there is definite stromal overgrowth. And very clearly, when you're looking and scanning at 10 hyper fields, you will be able to see more than 10 mitoses per 10 hyper fields. And these are diffusely infiltrative and have a permeative border. So that is classical of a malignant Phyllodes. So in other words, when you're looking at this, the important example to differentiate between fibroadenoma and Phyllodes is the present one example is if there is any presence of a malignant heterologous element. For example, if it is an element of osteosarcoma or chondrosarcoma or liposarcoma, it automatically upgrades the lesion to a malignant Phyllodes. There is no doubt. When you're looking at that slide and you have a heterologous element which is malignant, then it is a malignant Phyllodes. There is no doubt. And another practical reporting tip is if your attention is repeatedly drawn towards the stroma than the ducts, then and there is increased cellularity of the stroma, there is some atypia, some mitosis, some overgrowth, and a leaf-like pattern, think of Phyllodes and not fibroadenoma. And always remember, bland stroma with compressed ducts, think of fibroadenoma. Cellular stroma with a more leaf-like pattern, think of Phyllodes in the low power itself. Once you have diagnosed Phyllodes, use the 5 key elements which I have told you for making sure that it is a benign or borderline or malignant. For that, 5 elements have to be checked. That is cellular atypia. Is there increased cellularity of the stroma? Is there mitosis? Is there an overgrowth? And how are the borders? So this basically determines whether it is a fibroadenoma, whether it is a Phyllodes, or in the Phyllodes itself, whether it is benign, borderline, or malignant. So I hope you like this video. I will be adding many more such elements in the resident series where you have resident dilemma series in which you have these pitfalls or diagnostic gray zones. So regularly we will be putting these videos on my YouTube channel. So for further details, stay tuned to www.drdeepaslearninglaunch.com. So this is it for me from today. Bye-bye.